Now, there are reports that a senior official at the Norwegian embassy here in Accra and a Ghanaian diplomat from Turkey are the carriers of the coronavirus recorded in Ghana. This confirms the statement by Health Minister Kweku Agyeman-Manu that the two cases being handled by the country's health professionals were imported. Sources say the Ghanaian came in from Turkey, having gone there for an assignment with an international agency, while the Norwegian appears to have returned to Ghana after helping organize President Akufo-Addo's recent visit to the European country. At an emergency press conference on Thursday night by the Ministry of Information, Ms. Agyeman-Manu, flanked by Information Minister Kojo and Director of Public Health at the Ghana Health Service, Dr. Bedu Sarkodie, confirmed the coronavirus infection in Ghana.
The Ghana Health Service and the Minister responsible for Health, the Honorable Kweku Agyeman-Manu. This evening we have an update on the COVID-19 pandemic, and I'll invite the Honorable Minister to update the nation on where we are currently.
Thank you, Honorable Minister. Fellow Ghanaians, good evening. The Minister of Health has confirmed 2 cases of COVID-19. The cases were confirmed on the 12th of March, that is today, 2020, and the first cases to be reported in Ghana. Laboratory results of the 2 confirmed cases were received at the same time from the Noguchi Memorial Institute for Medical Research. Both individuals returned to Ghana, one from Norway and the other from Turkey. So these are imported cases of COVID-19. Both patients are currently being kept in isolation and are stable. We have initiated processes for contact tracing. I wish to assure Ghanaians that the government of Ghana, together with all health partners, will continue to work assiduously to ensure the situation is contained. We wish to encourage every Ghanaian to take care of their health and that of their families by adhering to the following precautionary measures: regular and thorough washing of hands with soap under running water and use of alcohol-based hand sanitizers. Avoid shaking of hands. Keep a distance of at least 2 meters from a person with fever, cough, sneezing, and difficulty in breathing. It is advisable to be physically active, drink plenty of water, eat healthy, avoid stress, and have enough sleep. Stay home if you feel unwell with symptoms of fever, cough, and difficulty in breathing, and call the following numbers immediately: 050-949-7700, 055-843-9868. I would like to repeat the numbers: 050-949-7700, 055-843-9868. Thank you. Good evening again.
So we're grateful. The government will provide further updates in the next 24 hours of other related matters, including a number of travel advisories. We're very grateful for your time.
While there seem to be variations in the symptoms depending on the incubation period, a Seattle woman who says she had the coronavirus is recovering and has one big takeaway to share: don't panic. The 37-year-old believes that she contracted the virus at a house party because a few days later, several friends who were at the same party became ill at the same time she did.
It was on a Saturday. That was February 22nd. 3 days later, I was at work. I started feeling that general feeling that we're all familiar with, where I was unwell, feeling tired, body aches, getting a headache, feeling a little bit feverish. And so I decided to go home early and work from home. I didn't think too much of it. I thought maybe I was just a little tired. I had been out a lot the previous weekend. I went and took a nap. When I woke up, I had 101-degree fever. And by the time I went to bed, it had soared to 103 degrees. At that point, I just thought that I had caught a nasty flu. I didn't think about the coronavirus at all. One of the reasons why is that I did not have a cough. I didn't have any respiratory symptoms. I didn't have any chest tightness or shortness of breath. And that's a lot of the hallmark symptoms that we're seeing that are being circulated right now with this virus. So the next day I woke up, my fever came down to 101. Over the next several days, I just took care of myself. I stayed home, I rested, I took over-the-counter medications. I didn't really start to wonder that it was coronavirus until I connected with a group of my friends who attended that same party. And it turns out that about a dozen or so of us all got sick at the exact same day, roughly around the same time in the evening, with very similar symptoms. Once I was connected with those other friends, I found out that they had all, not all of them, but some of them had gone to their doctors. Their doctors thought that they had just contracted the flu, and they were tested for flu and tested negative. So they were not tested for the coronavirus at their doctor's office. At this point, we were all getting a little frustrated that they weren't allowed to be tested for coronavirus, or the doctor wasn't even suggesting that they're tested. And that's when one of my friends that was part of this group brought our attention to the Seattle flu study. And this is a research study here in Seattle, and you can just volunteer and sign up online. They send you a nasal swab test kit, and you do a nasal swab and mail it off to them. And then they let you know if you have the flu and what strain it is. Now, just recently, a few weeks ago, they started testing for coronavirus as well. And so that's how I ultimately found out, correct.
Quickly before we go, you're very measured and calm. I know you have a PhD in bioengineering, but I know you talked about how your mother cried when she found out you had this. You were perhaps more curious than upset. But you know, for people out there who are afraid of this, what do you say to them now that you've been through it?
Yeah, that's a great question. So first of all, yes, my mother did cry. She didn't quite believe me that I was feeling better. You know, mothers are going to be a mother even if you're a 37-year-old woman. But I think the big takeaway I want to tell everyone is please don't panic. You know, this is an unknown, infectious agent that is relatively new to be infected in humans. However, if you are healthy, if you are younger, if you take good care of yourself when you're sick.
And that's a woman who just recovered from this COVID-19. Well, a virologist, Professor Kwame Nasego, says one can spread the virus whether they're showing symptoms or not.
I want to bring in now is that I have learned, I spoke to Joy FM before I came here, and I've learned that one of the people is a Ghanaian, one of the those who tested positive is a Ghanaian. Yes, so we should remove that myth that Africans cannot be infected. We shouldn't go there. There may be other reasons why we don't have that level of infections here as compared to China, Europe, and other places in America. So we need to be careful. So we should close that myth now that we have a Ghanaian who has tested positive in our own country. Okay, so now you have normally what you have called an incubation period. If you are infected by a virus, not only viruses, by any infectious agent, there's a time when from infection to a point where you will not show any symptoms. You look just like any of us sitting here when you're not sick. And sometimes these things you can transmit through even though you are not showing any signs, somebody can actually pick it up from you because the virus may be growing in your body, you see. So as the virus grows, maybe it needs to get to a certain level to destroy your respiratory tract to a certain level before you start showing the symptoms. So not having any symptoms doesn't mean you cannot transmit to someone. That's what we call the incubation period. And I think we should also bear in mind that a lot is still, the virus is unfolding and people are still trying to find out how does it really behave. So we should have maximum protection as much as possible. And so that's why they're doing contact tracing. The assumption is that these people sat on the plane. Did they touch anything on the plane? Were their hands somewhere? Were they coughing into the air? And did people inhale when we're coughing? So anything could have happened. So the idea of contact tracing is to make sure that those people are observed over a period of time.
We'll talk about all that.
Okay.
So I'm talking about 2 people.
Yes.
2 cases, I'll call them 2 cases. Yes. Before they left their place of origin, wherever they came from, they'll go through certain checks. Left their hotel rooms or homes.
Yes.
They take a cab. Those are the things I want you to take me through, the routine.
Oh, okay, I mean, you said it already. So basically,
I have not said
no.
it.
So they probably may have even gone to church or to the mosque before coming, and they went to the airport. They went through the processes. They may have gone to it. Probably will buy ticket online. So probably they bought it online. They paid online. When they picked a cab, or they were living with their family. Okay, their family children will go to school or they will go to work. So let's look at the big picture. And then they have now come to Ghana on the flight. They met people. They picked the cab from the airport home, or somebody picked them. That person would meet another person.
All right, so we're going to just bring you some updates on this COVID-19. In Canada, the Prime Minister Justin Trudeau's wife has tested positive for the new coronavirus. His office announced on Thursday night. The statement said Sophie Trudeau was feeling unwell and would remain in isolation. The First Lady of Canada had returned from a speaking engagement in Britain and had mild flu-like symptoms, including a low fever, late on Wednesday night. Let's go around the globe and check out how the figures are looking and what the headlines are. So, airline SAS to cut and suspend U.S. flights. That's one of the developments following this coronavirus. In Bulgaria, well, the state has declared a state of emergency over the coronavirus. The Bulgarian parliament voted unanimously to declare state of emergency until April 13 to contain the spread of coronavirus after the number of confirmed cases in the country rose to 23. Chelsea's Hudson Odoi says he's recovered. So this is an update, and this is from Al Jazeera, really. And so this is a quote. He says, I had the virus for the last couple of days, which I've recovered from. Chelsea forward Hudson Odoi said in the video message out on Twitter. So that's certainly some good news. And the news is not every person who gets the virus that will die. Doesn't mean that when you get the virus, you are dead or you're going to die or it's a death sentence. Some people actually recover. We have great numbers who have recovered. In Spain, Catalonia puts 4 towns under quarantine. 4 towns in Spain's northeastern autonomous region of Catalonia have been put under quarantine due to the coronavirus pandemic. Lithuania to close all schools, universities and kindergartens. Well, the government said it will close all schools, universities and kindergartens in the country for 2 weeks to limit the spread of the new coronavirus. Let's go to Tokyo. Well, they say the metropolitan government said it would postpone the opening ceremony of the Olympic Aquatic Center due to the coronavirus outbreak. The opening ceremony had been planned for March 22nd. Dutch health authorities say the confirmed cases of the coronavirus rose to 614. In the Netherlands, the country's prime minister said his government will introduce new measures to trace the new coronavirus cases. Kazakh citizens have tested positive coronavirus after returning from Germany. The first cases of the disease in a Central Asian country. So the disease, this virus continues to spread in other countries for the very first time, different countries recording the cases of the virus as well. Armenian Prime Minister said Armenia will shut educational institutions immediately over coronavirus fears until March 23rd. They've recorded 6 cases of the coronavirus. And then Asian financial markets slammed on Friday after Wall Street posted its worst single-day crash since 1987, but quickly recouped losses as policymakers ramped up efforts to fight the coronavirus outbreak and its economic effect. Well, in Italy, millions are locked down and more than 1,000 people have died from the coronavirus. It's the worst hit in Europe. But in South Korea, which was hit by the disease at about the same time, only a few thousand are quarantined and 67 people have died. So what it is quite a good number of people have the virus in Italy, but what is worse is many more are also dying out of the virus, unlike other countries. The Czech government will require people returning from all high-risk countries to quarantine themselves, widening the requirement so far only applied to those returning from Italy, according to their foreign minister, who posted on Twitter. Apple Incorporated has also reopened all 42 of its branded stores in China more than a month after they were shut due to fears over the coronavirus outbreak. We're just going to cross over and but before we do that, let's talk about Kenya. Kenya registered its first confirmed case of the new coronavirus. The patient, who was diagnosed on the night of March 12, had traveled back to Kenya from the United States via London, according to the information that is out there. Well, in Ghana, we've recorded 2 cases. We're told one is Ghanaian, one is Norwegian. Here's the information. Minister Kojo Ponkroma speaking on the Super Morning Show on Joy FM with more details about this case.
When the matters were in Wuhan and Hubei, China, the assessment was different. When it now moved to Europe as an epicenter, northern Italy or Italy, UK, etc., the assessment changed. Midway, the president caused the Ministry of Finance to prepare an economic or a potential economic impact assessment, which then also now throws out or shows you how much this country will lose in terms of human lives, economic activity, etc., if we have A, an incident, B, a surge. As these assessments keep getting done, you now have a clearer picture that shows you how you have to step up even your preparedness. For example, the number of beds in your quarantine center. Are they enough to hold an initial case? Yes. Medium level cases? Yes. What if you have a surge? Will one quarantine center be enough? Then now you begin to step up those numbers. Isolation centers and the equipment, the PPE required there. If you have an index case like this, yes. Mid-level cases, yes. What if you have a surge? So it is that continuing analysis that has snowballed that we should earmark about $100 million cedi equivalent. It doesn't mean that that $100 million has been shared for people to go and use. No. It is resource that has been made available. You now have to come to the specifics like we do with all the public financial management issues in Ghana. You now have to come to the specifics that we need to buy 2,000 masks and gloves to augment what every regional hospital has, because you do not know if you are going to get a case in Asankragwa. So if our quarantine center is in Accra and you get a case in Asankragwa, how are you ensuring that they have PPE? Then now you know you have to step up, because now if you start getting...
We'll stay with the subject because the Ghana Tourism Authority has directed all operators in the tourism and hospitality industry across the country to immediately start screening all guests before giving them access to their facilities. This is one of several measures put in place by the authority to ensure the industry is well protected against the deadly coronavirus. At a meeting with industry players Thursday, Chief Executive Officer Akwesi Agyeman said although the hospitality industry has been badly hit by the outbreak, his outfit will continue to ensure that everyone in the industry is well protected and can continue their businesses without fear and panic. Here's Efwa Evans Chinri's report.
The World Health Organization has declared the coronavirus outbreak a pandemic as Italy tightened its quarantine and the U.S. imposed a ban on flights from Europe. More than 126,000 have been infected globally, according to the WHO. Of this number, over 68,000 have recovered. A number of institutions have put in place precautionary measures against the disease. One of such institutions is the Ghana Tourism Authority. Its Chief Executive Officer, Akwesi Agyeman, wants all companies in the tourism and hospitality industry to ensure everyone is very well protected.
We are telling our operators not to be scared, but just to take care. So the tagline is, don't be scared, just take care. And we are asking that at every public area in a establishment, there has to be an open display of the messages, and these are messages that we have printed, and they have to paste out there. One, avoiding handshakes, the various precautionary measures that the Ghana Health Service has advised. Two, we're asking all hotels to ensure that in the hotel rooms, these messages are boldly displayed, and there are sanitizers and other washing equipment that is available for people to wash their hands and avoid the handshakes. Also, in the area of the restaurants and the kitchen, they have to wear the protective gear. That will ensure that at least if even somebody has a symptom that is closer to coronavirus, they are properly monitored, and so we've asked that we get the testing guns, that we call them, to test their temperatures, and people with high temperatures are then isolated and then asked to liaise with the Ghana Health Service on that. We're also looking at general staff health. We know that per the regulations that we have, staff have to have a certain health certification by the various assemblies, and this time we are going to enforce that because they are the frontline people and they have to ensure. And by and large, we also here to keep the industry upbeat, that we are very, very confident in the measures that central government have put in place. We are very confident that thus far we haven't had any incident, and we are very assured of the readiness of the country to deal with the situation as we go forward.
Adnan Yusil is general manager at the Movenpick Ambassador Hotel. He mentions some of the challenges they face as an industry.
So since the pandemic disease started to spread all around Europe, we start to receive a lot of cancellations, especially from global institutions, international companies. Actually, we're supposed to have IMF, World Bank meetings, some UNDP meetings, and some United States related meetings as well. They're all suddenly canceled. So we received thousands of room nights cancellations for March, April, and May, which accumulated to actually hundreds of thousands US dollars, which affected us dramatically. So now we are trying to take some precautions. Of course, we are an international company as a Movenpick. We are part of Accor. So we submit a lot of reports on how to reduce costs, how to hold on to our revenue. So now actually we try to minimize our costs.
Inspectors have been deployed to the various industries to ensure operators adhere to rules and regulations.
Well, after that announcement, the news team visited some of the facilities to see for themselves how prepared they are.
We have placed hand sanitizers at the front of the hotel. That's the entrance when you are coming in. The restaurants, we have one also at the reception area, and we have some at the gym. So we are actually...
So there are sanitizers, hand sanitizers all over, in the rooms, everywhere.
Yes, yes.
So let's talk about this. Where are you going to stick these ones?
So this one, we are going to stick some at the security checkpoint for the staff when they are clocking in, so that they can be reading and be aware of what to do when they are on duty. And also we'll place some also over there. Once guests are coming in, they can also be reading what they have to do to prevent coronavirus.
You know, we all don't speak English. What about those who speak other languages? How are they going to get to know about this?
We have people at the security checkpoint, and they can educate them. That is, if they get there and they read and they are not able to understand. But then if you look at the signage, you could see that, you know, this is something so easy that everybody could read. There is cross, that is don't do, and this is okay, meaning that you can wash your hands and all that. So the green one...
Without necessarily reading, you can tell. We're at the gym at the Alisa Hotel, and Yvonne is here to tell us what you have to do before you can enter the gym. So before you get into the gym, you have to sanitize.
Sanitizer to sanitize your hands. And then after that, you open the door. This has been cleaned already with the alcohol.
Okay.
Today going, we will put the stickers there so that you clean as you go with the sanitizers. Okay. Internally also, when you finish cleaning it, because of the safety of our customers, we will also do the alcohol cleaning to make sure that the treadmill is safe for them to use. Yes.
Okay. So apart from the treadmills, you're going to do the same with the other machines as well?
We are using alcohol to clean all the machines at the gym, So as and when they finish using it, we come back and then do the cleaning for this ones. Because this one, you don't normally sweat like the treadmill. So we do this ones for them.
I think it's a good idea on the part of the GTA, and we've also spoken about the coronavirus and its effect on the hotel business. I think we have also taken up some measures for the hotel and the guests incoming and in-house as well. Currently, we've taken up a measure that all staff will be given gloves and nose masks. Like you see, I have my glove here. There are 2, and each staff has also been given, sanitizers as well.